about depression in women, symptoms, causes, and treatment. So, depression in women, what is depression? Depression is the greatest disease which affects most of the women. Around 41% of the women suffer from depression as compared to only 29% men. So why is so depression so prevalent in women? Depression is common, but it's common, but it is a serious mood disorder. It not only involves your mood, it also involves your emotions. It involves your it interferes with your everyday activity, like you can't eat properly, you can't do things properly in day-to-day life, you can't sleep. Then also it has certain times it goes to an extreme of suicide ideation. You start having thoughts that the life is useless, you don't want to live life. The causes of depression still they are not known. Some say that it is a genetic, if your parents suffer from depression, so you will suffer from depression. Some say it is environmental depression, that certain changes in the environment that leads to sadness. Extreme sadness is, if it is there, we will talk about it later, that what does extreme sadness and what are the symptoms of depression. But there are environmental factors which might include stress in your office, stress at home, stress at various work areas, or other psychological and biological factors. So, the common symptoms of depression now, what are the common symptoms? As you can see the slide, the common symptoms would include persistent sadness. If this sadness is for more than 2 weeks, if the sadness, everybody of us is sad. We are sad for no rhyme and reason sometimes, so it doesn't mean that you have depression. But if you are sad for more than 2 weeks, if you don't feel like doing the daily chores of your life, like taking a bath, eating food, doing normal routines like getting up from the bed, then if you feel very pessimist or if you are very negative and hopeless, you're helpless, you don't know what to do, and worthless. You feel it's no point living, you are a useless person on this earth, all these emotions. Then, if you're very irritable, at your workplace, at your home, in your school, in your college, and the children suffer. We talk about adolescent depression also. Then, if there are increase in anger, because irritability is the starting point, and anger is the extreme or aggression. That is also a symptom for 2 weeks if you're suffering from irritability every day. That is also depression. Then difficulty in sleeping, whether it is sleeping. Now there are three stages where we study sleeping. When you can't sleep late till night and you get up in the middle of the night, or when you wake up early in the very early in the morning, like 2 or 3, and you sleep by 11 and then you get up by 3, or sleep by 12 or get up by 4. Only you have 3 to 4 hours of sleep. You feel tired and fatigued all the time. You have difficulty in remembering things. Concentration is a big, whatever work you're doing, there's a big problem. Then, as I said, thoughts of suicide, and then you also suffer from psychosomatic disorders. Like you'll have aches and pains here and there in your body. You'll have digestion problems. You won't be able to digest things when you're depressed. So there are three types of depression in women. One depression is depression in puberty, the adolescent depression, women depression. Then depression during pregnancy, and later half is during menopause. So these are the three stages where women go through in the life, and they see a tremendous change in the hormonal system. There's a lot of change in the environment, and there is a lot of change in their own body composition. So naturally, when you're going through a change, you feel little sad or depressed when you're not able to cope up, if you do not have the life skills to cope up with these changes. Now, talking about premenstrual, or when we said depression during puberty. When you talk about puberty depression is premenstrual depression. When it starts from 3 to 4 days before you start with your periods. You start feeling sad, you start feeling irritable. There are mood swings, frequent mood swings. In this also we see there are extreme depressions depressive disorder is extreme, or maybe it is just a minor irritability or sadness. Even at a drop of a hat, you feel angry. If there's nothing, then later when you feel कि अभी तो कुछ हुआ ही नहीं था, still I'm feeling so angry and irritable. And even if your colleagues or your siblings tell you कि तू इतनी irritable क्यों है, why are you so angry? We didn't say you anything. So that's when you understand your periods are approaching, and then depression also means you start crying for no reason. Sometimes we start crying when somebody tells us कि तुम अच्छे नहीं लग रहे हो, what have you worn? These are small statements which mean nothing, but then you feel depressed, you feel sad. So premenstrual dysphoric disorder is when it is a severe form of premenstrual depression or a stress, when you feel that nothing in your life is right before your periods. Just before, 3 or 4 days before your periods, you start feeling hopelessness, uselessness, worthlessness. You start feeling sad, you start crying, you start feeling irritable. That's a premenstrual depression. 50% of Indian women suffer from premenstrual depression, and they do not talk about it. They do not, because they are not aware that this premenstrual depression exists. Now, once we recognize that this exists, once we know that, okay, now my periods are approaching, so I'm going to feel sad, we can easily deal with the depression, or we can deal with the symptoms. We can do stuff like taking care of our body needs, and also not reacting to situations. Now we know that our periods are approaching. Let's not get angry at the drop of a hat. Even if we are angry, we can tell our siblings and colleagues, अभी मुझसे बात नहीं करना, I'm very irritable, so don't talk to me, just give me some space, I'll be fine after 3 days. So it's quite easy if we recognize that we are going through depression. But if we do not recognize, sometimes it can be devastating for a relationship. You can break a relationship, you can leave your jobs. We have seen impulsive decision being taken due to premenstrual depression by adolescent girls. They get into alcohol, smoking sometimes. So you become so impulsive and reactive and emotionally vulnerable. Emotional instability is an inherent part of a woman or a girl since the time she is born. But all these pointers help us to deal with this emotional instability. So when you know you are going through a premenstrual depression, just be aware of it. That okay, and in case you feel that it is an extreme form, as we say, then it is an ongoing mood disorder. It doesn't get corrective even after the menstrual cycle is over. After 5 days of menstrual, after the second or the third day, usually you come out of the depressive symptom. But if it still persists, please go and seek medical help and medical advice. Go and talk to your gynecologist, take counseling sessions. Half of premenstrual depression, more than half, 60%, we deal through psychotherapies. But still, if it is not corrected, then we need to see a psychiatrist. That is in extreme cases. Now we talk about depression during pregnancy. So pregnancy is quite a stressful period. Pre-pregnancy and post-delivery. These are the two stages where we see women coming to us with a lot of depressive disorders. Their body is changing, there are hormonal shifts, there are mood swings, then there's a new challenge of taking care of another child, another human, another living being. So it's quite challenging. So prenatal depression and postpartum depression, these are the terms that we use. Prenatal depression is during the pregnancy, which should be cured through psychotherapy, but postnatal depression, but if it is again the same thing, if it is persists for more than 2 weeks and still we are crying, we are having episodes of anger, we are having episodes of sadness, then we definitely need to take some medication. If you're not able to sleep, as I talked about it earlier, depression when you deliver a child. I've seen patients coming to us when they don't want to see the child. अभी मेरा मन नहीं कर रहा इसको फीड करने का, मेरे को रोना आता है जब मैं इसको देखती हूँ, या मैं इसको उठा नहीं पाती हूँ, मुझे डर लगता है. और ये persist करती है डिलीवरी के तीसरे चौथे पांचवें हफ्ते तक. And the caregivers, the nani, dadi, everybody around you, they're not able to understand that when it is a time that you should be happy that you've given birth to a child, whereas you are sad. All the time you are sad. So when you are sad, so what happens is that people around you try and counsel you. It's a beautiful feeling, but still you're not able to get over it. The moment you see the child, or you anyway you have sleepless nights, the sleep goes haywire. You have sleep disorders, but still, if you are sleeping and in the middle of the night you just wake up and start crying for no reason, and the child is also sleeping, and then people around you are in a state of a shock कि ऐसा कैसे हो गया है ना क्यों रो रहे हो कोई कारण नहीं है फिर भी आप रो रहे हो. So that's the time you should need a help. You need medical intervention. You need specialized intervention, whether through psychologist or psychiatrist or your gynecologist. She will also identify. Your gynecologist will know that you're suffering from postpartum depression. The postpartum depression can be easily dealt with. It is another name for postpartum depression, baby blues. So it's nothing to feel guilty. Okay, I should feel. The more you add on to your negative emotions during your prenatal or postnatal, the more depression, the extent of or the severity of the depression increases. Like now you have guilt. I'm not taking care of the child. Anyway, you're depressed. So this guilt is another emotion that you're adding. That's a negative emotion. So you're adding on. That guilt increases your depression to a larger extent. Then you again feel like this. So there's a cycle that has to be broken. There's a vicious circle that has to be broken. So if you see any of these signs, you should go to the doctor and consult the doctor. They might give you mild antidepressants. That I'll talk about what antidepressants do to our body. So now we talk about after prenatal or postpartum depression. There's another phase in women's life that is called emptiness syndrome or premenopausal depression. This is a time when your children are in class 12 usually, or normally 90% ladies go through this phase when the children are in class 12 and they're about to go to the colleges. So the homes are going to get empty. Initially, they are so occupied with the children, the tuitions pe chhodna, activities pe leke jana. So suddenly now, from all these activities, they find themselves doing nothing, sitting at home, and also their body is also playing with them, playing as in it's a challenging phase because there are hormonal changes in the body. So now you're having a premenopause. And then your periods are going to stop. The egg formation is going to stop in your body. So it is going to create havoc in your body as well as in your brain. You have more mood swings. You have anxiety. You have sadness, or you don't want to do anything because one, there is no motivation to do anything because there is nobody in the house. The whole day you're alone. And the children are out the whole day, and it's just the meal time they join you, or sometimes they have been shifted because of their career to different stations. So there's no recreation for you because you've never invested in recreation. So it's important for us to understand that premenopausal depression is seeping in, and we need to deal with it. So again, any psychiatric or psychological disorder, if we are aware of that disorder, it's very easy for us to deal with that disorder. It's very easy for us to come out of the disorder as early as possible. But if that disorder persists for more time and we are not aware and we just let it be, we try and fix it on our own, but we're not unable to fix it, then we just let it be. We just have a sit back attitude and let ki ho jayenge theek. Maybe that's how I have become. So it's not like that. So even if now in the premenopausal state, now I know I'm going to be alone, I have mood swings. So let me figure out what all activities I can add into my routine that would give me enjoyment, that would give me kind of a recreation that helps my mental growth. So now in this stage, there are a few activities I can suggest, like doing a lot of social work, getting into more of friends, and doing something which is more constructive, learning a new skill, and also maybe you can, what I have seen women doing is they learn a new handicraft or a creative skill, maybe music or maybe painting or something, and then they start a profession anew. So there is no age bar that you start a profession at this age. You can do it anytime. So there are certain stigmas and there are certain limitations which we need to break during those times. So after talking about menopausal depression, now what can be done? See, as I said, medication is the first, is the should be the first option. You should see medical help. If it is severe depression, your psychiatrist would tell you whether you're going through. There are three types of depression: mild, moderate, and severe. So, if you are going through severe depression, no psychotherapy can help you. And if we do early intervention, from mild depression, we can avoid medication. In moderate depression also, we can avoid medication. But in severe depression, I would suggest to first, because whatever as a psychologist, we suggest you, we talk to you, it doesn't go anywhere. You know, when you go back home, you again forget and you again sit back on your seats, and again the story in your mind keeps running, and it is a psychomotor retardation in depression, which is you want to sit at one place and keep thinking. So that's called a psychomotor retardation. So you enjoy that. When you're in depressed state, you start enjoying it. Just scrolling through your phone. Nowadays, playing useless games all through 3 or 4 hours a day, sitting at one place. That's the time we need to understand we're going through depression. Then staying connected is an essential part of depressive treatment. See, if in the premenopausal depression, this is the only treatment, by staying connected with others. Because if you talk to your own age friends, your own people who are going through menopause, it becomes kind of a support group. And when it comes to postpartum depression, when you talk to elders around you, okay, this is what I'm going through, they are the one who are going to help you. Every family member in the house, everybody around, all the friends, they are the biggest psychologists on the earth. You don't need a professional help till the time you're connected with people. Staying disconnected, which we term as social dysfunctioning. We do not, when we are depressed, we definitely do not want to talk to anybody. We just want to sit at one place, do nothing, and just keep thinking and making our own story. So that's called a social dysfunctioning. So staying connected is the priority that you should do when you are going through any kind of a mood disorder or any kind of a depressive disorder. Exercise, what it does is, there are certain brain neurotransmitters or brain chemicals, happiness hormones that we call. So happiness hormones get secreted when you have proper diet, when you exercise daily without fail. Without fail, you are secreting. When we say that he or she is addicted to gym, why are the gymming so addictive? Because it secretes all these positive chemicals in the brain which you feel happy about. When you go to a gym, you feel so good and elated, you feel nice. So exercise emits all these neurotransmitters which give you happiness. So which you can, all these alternate things are to avoid medication only if you are, again, only if you have mild to moderate depression. But if you have a severe, even after moderate depression, psychiatrists would definitely, I would suggest, always go to a psychiatrist before going for a psychotherapy. He would put you on mild medication and then psychotherapy is addition to that. What happens in depression, the thought process remains the same. Now, to change the thought process, medicines are not sufficient. You need to go to a psychologist, because here is when we identify your old habits and we try changing those habits into newer ones, which will help you to deal with the environment better. Now, it's also important to read more about depression. It's important to read. Nowadays, all of us, we want to go to Google and we want to identify what we are going through, how is it treated, the side effects of the medication that we. That doesn't negate the role of a doctor. Please visit a doctor. If you're doing Googling also, which is also fine. Then the family causes of depression. What are the basic causes? One is family history. Family history, it is genetic cause. Sometimes the depression is in our genes. There is no external cause, there is no physical cause. You are not going through PMS, you're not going through postpartum, you're not going through premenopausal, but you are still depressed. So most of the women feel depressed because somewhere in the genes there is this genetic predisposition for depression. So there are also, as I said, deficiencies of few chemicals. As I told you earlier, that there are brain neurotransmitters which are functioning in your brain, which create happiness in your brain. So if there is a deficiency in the secretion of these chemicals, so even if you try all kind of treatment, whether it is any kind of a holistic treatment, non-medical intervention, it is not going to help because those chemicals do not get secreted. Even after exercising, as I said, exercise to some extent helps, but if there is a deficiency, now for example, the thyroid gland doesn't start functioning on its own even if you do alternate. You need to have thyroid medicine. It is the same with the brain. You need to have medicine to secrete the hormones like serotonin, dopamine, norepinephrine. You have to have all medicine for this. So don't consider depression as a stigma and going to a psychiatrist as a stigma. If we have throat infection, we definitely take medicine for throat infection. But when we have depression, we avoid taking medicine. So this mindset of Indian society has to change. If you have to have medicine, you will not get treated with any other kind of. अब नींद नहीं आ रही है, so no matter how hard you try, people who go through depression will understand this. How hard they try, they will not be fine even if they do 101 things for the sleep. They will have to have medicine.
वो कह रही है कि 12 बस ये स्लाइड में दोबारा डिस्टर्ब ठीक सॉरी सॉरी
So we were talking about causes of depression. The first cause of depression is genetic cause, the medical cause that I have just written as a family history. Genetic, when there are genes which have predisposition for depression, so there will be certain chemicals in your brain which would not be secreted automatically. Now, when you have, as I was giving an analogy, that you have thyroid dysfunctioning, so you will have to have medicine for thyroid gland to function again. Some of us in India, they tried homeopathy. Some of us, we have Tylenol, but that is the only treatment. That is the only cure for thyroid. That's a master gland to function. So similarly, in depression, if you have genetic cause, if you have genes or your parents or your hierarchy of depression, then you need to understand that without medication, it cannot be treated. So going to a psychiatrist or going to a psychologist. Now, psychiatrist would give you the medicine, but your thought pattern, only a psychologist or a counselor can deal with it and they can understand. Psychiatrists also do counseling. They also do psychotherapy. So it depends upon what kind of a psychiatrist you choose. If he's a good psychiatrist, he will counsel you definitely. But psychologist, as a psychologist, I have seen only medication doesn't work wonders. You will have to have psychotherapies along with medication to improve your thought process. Now, apart from genetic causes, there are certain environmental factors that cause depression. So, major environmental factors, major episodes that cause depression are post-traumatic stresses like death of a family or a prolonged illness like cancer. So when you're going through a medical treatment for a longer period of time, that's when you suffer from depression. You have multiple surgeries, so that's when you have depression. As I said, death also has, when there's a death in the family, you go through 5 stages of grief. In psychology, we call 5 stages of grief. Now, in this stage, first stage would be anger, denial. These stages, there's no first or second, they keep shifting. So you shift from one stage to another. First you are angry probably at the doctors, probably at the relatives, ऐसे कर लेते, वैसे कर लेते. Then there is a denial की नहीं हो सकता, denial पहले भी हो सकता है कि ऐसा नहीं हो सकता, सब झूठ बोल रहे हैं, he's alive. Then there is anger and depression. So when there is and depression and sadness, right? So when you are going through a depressive phase, when you're sad, you don't want to talk to anybody, you're crying all the time. Initially, we misunderstand it as a grief, but the grief is, if it is prolonging for more than 3 to 4 weeks, then we need to take medical help. Then certain medications that you are taking for a longer period of time, certain combination of medication that is required for your physical health also may cause depression. So the only thing we need to understand is the symptoms that we've discussed earlier. Then use of alcohol and drugs, they are the major contributors of depression nowadays in adolescents and in adults also. Since the drug prevalence in North India is increasing, the alcohol addiction is increasing day by day. So what alcohol and drugs do, the chemicals that we are talking about that creates happiness, they increase with alcohol and drugs automatically. Now, there's an external substance which is increasing the secretion of these chemicals. Now, if you're taking alcohol and drugs for more than a year, 2 years, 3 years, so your brain gets accustomed for these increase of chemicals through external agents. If you think you're going to be happy when you don't take them, that's called a withdrawal symptoms that we usually say in common terms. But it is basically non-secretion of all the chemicals without external agent. So when the chemicals are not secreted, you're not happy, you are sad all the time. Sometimes there is no reason for depression. Sometimes their seasonal affective disorder also causes depression, like in extreme winters, people staying in London or in places where there's lack of sunlight for days to come. So you start experiencing those sadness. you are sad all the time, you don't know what to do, you don't have the energy to do daily activity. So that's when it's no reason. This cannot be a permanent reason. Like you have seasonal affective disorder is not a disorder, permanent disorder. It can easily be cured until and unless we are, again, if you're aware, you're treating half of your depression or any psychiatric illness. If you're aware that you're suffering from it. But if you're not aware, you won't be able to deal with it on your own. Then professional treatment is helpful in any of these depressions, whether it is a premenopausal depression, postnatal, prenatal, or in kind of a PMS, premenopausal, yeah. Then psychotherapy and counseling helps in depression. So there are two types of therapies that we do. One is family therapy, and there is individual interpersonal psychotherapy. So when we see that usually in premenopausal depression, it is more to do with family and the environment. So we take in the family also when we do counseling sessions, so that we need the support of the family. Even in drugs addiction, we do family counseling more than we do. In case of schizophrenia, we do more attendant counseling. So counseling is an integral part of any kind of psychiatry or psychological depression or any kind of illness. So medication is counseling does help only if you are ready to listen to a psychologist. अब अगर हम बोल रहे हैं और आपको हमारी बात नहीं समझ में आ रही है, हम बोले जा रहे हैं suggestions, तो everybody of us in India is a psychologist. Everybody is giving you best suggestions, whatever they understand. But then at the end of the day, the suggestions, you're if not taking it, then it doesn't help. Now, if you know, sometimes some people who have depression, you should take action. See for a medical doctor or a counselor around you or a psychologist. Do some energy exercises. As I said, the importance of exercising and how it increases your brain chemicals. Then avoid extra stress or big changes. When you are depressed or you're going through some kind of a mood disorder, this is a very important point. You should not take any decisions in your life which involves a long-term consequences. So do not decide anything or do not react to anything immediately. So take a pause, just hold on, and then react. Then you can. It's very important when you are on medication for depression to eliminate alcohol or any kind of drugs that you are taking. Eat proper, well-balanced diet. It's important to sleep and form a pattern of sleeping. If you're sleeping at 10 o'clock at night, please sleep at 10 o'clock. Because once you're going through any medical psychiatric illness, if that pattern breaks, then the sleep gets disturbed and then it forms a vicious circle of your mood. So it's important to have a regular sleep throughout your phase that you're taking medication and psychotherapy. Then obtain equal amount, apart from sleep, also, as I said, importance of family members. Then pace yourself, modify your schedule. If you are, you think your lifestyle needs a change. Usually during premenopausal, there's an extreme change in the lifestyle. Then, because as I said, children go away, so you need to change your lifestyle. And remember, depression is only temporary. It is not reflection of who you are. Don't blame yourself. Don't have again another emotion of guilt. Okay, why am I going through this? Then, as I said, this hopelessness feeling you have during depression, it is normal. So there is nothing wrong with you. You just accept, okay, I'm feeling very awful about myself now, right now. I am really feeling bad about myself. Let me do something about it. If you don't want to do it, just let that feeling pass. Just sit back and avoid taking any kind of an action. Avoid taking comments of other people personally. If the people around you are critical, if they are being sarcastic, just avoid taking it personally and then getting sad and making another story in your head. For the friends, now if you have a friend who's feeling depressed, so just be empathetic. Don't say कि क्या हो रहा है, कुछ नहीं होता depression, ऐसे नहीं होता है, there's nothing word called depression, you were just feeling low for no rhyme and reason. No, just be empathetic and understand. Then if you empathize with the feeling of anger and frustration and grief of the other person, that's when you are actually helping that person come out of the depression. Don't argue over things that a person is going through. That okay, नहीं तेरे को ऐसा नहीं सोचना चाहिए. Why are you thinking like that? This is a wrong thought. Don't argue. Just say, okay, I understand you're feeling like this. What happens is there's a beautiful analogy which we use when you're talking to a depressed person and you are bringing him out of a depression and counseling and encouraging him by contradicting their thought process. It is like giving a drug addict a drug, because they want people to contradict ऐसा नहीं है, and they want to feel more miserable. Sometimes in depression you start enjoying your depression by making yourself feel more miserable. So any external event which makes them feel more miserable, they'll enjoy it. So just say, okay, I don't contradict. Just say, okay, I understand. When patients come to us, we tell them, yes, you're going through this phase. You are feeling hopeless. I understand you are feeling having a suicide feeling for yourself. You don't want to live. We understand that totally. That's how you deal with depression. So if the person is angry and irritable, you don't have to react to the anger. Then advocate for the recovery, convey that if there's always a hope. As I said, empathy is important. Then be supportive for doctors and counselors. Just tell them, please go to see a doctor. I'll take you to see your doctor and counselor. That's how you can help. Thank you so much. Any questions? I'm always here with you in Paras Bliss Hospital. Thank you.